Good afternoon. For my chronic care model, I am using diabetes as my focus of discussion. Diabetes is a chronic health condition that affects how the body turns food into energy. And if a person is diabetic, the body either doesn't make enough insulin or it cannot use the insulin it makes, causing too much blood sugar in the bloodstream. Now, there are different risk factors associated with diabetes. This include physical inactivity, overweight and obesity, high blood pressure, and high cholesterol. When you say physical inactivity, it means getting less than 10 minutes of a week of moderate or vigorous activity. When you say overweight or obesity, this is defined as body mass index of 25 kilograms per square meter or higher. And then when you say high blood pressure, this means systolic blood pressure of 140 millimeters per mercury or higher, and a diastolic blood pressure of 90. And finally, when you say high cholesterol, it means non-HDL level of 1.3 milligrams per deciliter or higher. Now, according to the National Diabetes Statistical Report of 2020, there are a total of 34.2 million people, or about 10.5% of the US population, who are considered diabetic. And if recent trends continue at the same rate, 1 in 3 US adults could have diabetes by 2050. Diabetes is also the nation's seventh leading cause of death. This accounts for more than 79,000 deaths annually. Now, diabetes imposes a substantial economic burden on society and is one of the costliest chronic diseases. This accounts for about $245 billion in economic costs in 2012 alone. This includes about $176 billion in direct medical costs and $69 billion in reduced productivity. Now, the lost productivity is attributable to diagnosed diabetes is also estimated to be $323 billion in 2017. Now, for the chronic care model, with primary care providers should know how often patients go to the clinic every year as part of their continuous diabetic care. There is at least 26% of US adults with diabetes reported seeing their healthcare providers fewer than 2 times in the past 12 months for diabetic care. And we want to know if they have issues with regards to insurance coverage or problems with transportation when going to the clinic. Now, let me share you there are other steps that can be done when taking care of patients with diabetes as part of the chronic care model. Actually, there are 3 steps. The first step is to ask the patients how many times they had their hemoglobin A1C checked in the past 12 months. Now, hemoglobin A1C measures the average blood sugar level and should be done every 3 months. It is used to diagnose pre-diabetic and diabetics, and is the main test that the healthcare team rely on when managing diabetes. The second step would be asking the patient if they have a podiatrist and how often they see them. Now, food care is important when dealing with diabetic patients. And the last step to consider is to getting their weight regularly and compare them with the data from the previous year. You know, um, BMI is an estimate of body fat and a good gauge of one's risk of getting diseases like heart disease, high blood pressure, and diabetes. Now, there are other resources out there for taking care of diabetes. Um, there are community health workers who can serve as connectors between undeserved communities and healthcare systems. They can introduce programs that focus on diabetes, like diabetic prevention, which aim to reduce one or more risk factors for type 2 diabetes among members of the community. Now, this is done by improving their diet, physical activity, and weight management. And there are also diabetes self management classes that give individuals an overview of diabetes and educates them on blood glucose monitoring, carbohydrate counting, meal planning, medication and insulin administration, and the importance of preventing diabetes or diabetic complications. Now, participants return for follow up lab works every 3 months for 1 year. So, in conclusion, diabetes is a health concern of great magnitude, and it demands significant attention from healthcare providers because of the adverse effects that diabetes can have on one's life and productivity. There should be an increased awareness about diabetes, its cause, signs and symptoms, early detection and treatment. That is why the information mentioned in my paper will serve as a baseline for future research. Thank you.